16 minutes past 11. Good morning, Malaysia. Otto here, coming to you live from Angkasa Puri, Kuala Lumpur. Also live on TikTok and Facebook at TRAXXfm Official. That's TRAXXfm OFFICIAL. So if you want to know what question we're going to ask our guests here today and know what topic we're talking about, head over there right now. And should you have any questions, post it on up there or just give me a call at 03-2282-5491 or 03-2282-4746. Now, we are live currently in the studios, and we have currently sitting in front of me is Professor Dr. Muhammad Haniki Mohamad, the head of the Quit Smoking Action Team, Medical and Health Cluster Academy of Professor Malaysia, and also Mr. Munaver Ahmad, a CEO, Rhazes TeleHealth International Sendirian Berhad, my MQuit partner 4.0 MOH. Thank you very much, gentlemen, for coming to the studio today.
Thank you for having us.
Now, today's topic has to do something about smoking. So the topic is strengthening the O in Mpower, support to quit smoking and vaping. So the O in Mpower stands for offering help to quit smoking and vaping. So first of all, the first question is, why is this such a critical component of tobacco control? And also, how does it actually impact public health? Let's start with the professor.
Yes, thank you so much. And may I also wish all the listeners Selamat Hari Raya.
Oh, yes.
Yes. And thank you to TRAXXfm for having us today. Basically, the O, as you mentioned, is to offer help to quit. It can be of any tobacco products, including conventional cigarettes, or now we're seeing more electronic cigarettes being used. It's part of the WHO, or the World Health Organization, Framework Convention on Tobacco Control, or FCTC, which is the first global public health treaty negotiated under the auspices of the WHO. Its goal is to respond to the growing tobacco epidemic and the devastating health impact. So the M stands for monitoring. P is to protect, particularly the non-smokers. O is the offering help or cessation. And then MPOW is to warn people about the dangers of tobacco. Mm-hmm. E is to enforce a ban on tobacco advertising, promotion and sponsorship. And the last one is R, to raise tax, meaning that to increase the price on tobacco products. Mm-hmm. So zooming in on O, because we know the majority of smokers who are dependent on nicotine, they actually fit the criteria of tobacco use disorder, which is under the American Psychiatric Association. We call it Diagnostic and Statistical Manual, the 5th edition. So they already have like a disorder, or in simple terms, a disease. Mm-hmm. So they actually warrant treatment. And as health professionals, we need to see people who are dependent on nicotine as patients in need of interventions, whether it's pharmacological, meaning with medications, or using behavior. But the best is actually, DJ Otto and all the listeners, is a combination of both. We treat people using approved medications for cessation and also behavior interventions. Studies have shown that this can increase the success rate. So that's why we need to focus on O. It seems to be the least part being focused of all the Mpower strategies. Because I think people think, oh, it's just a habit, right? Mm-hmm. So if it's a habit, people can quit or just abandon the habit easily. In actual fact, it's not. Nicotine is a very powerful, addictive chemical. Mm-hmm. And the younger someone is exposed to nicotine, the higher the risk of becoming dependent for lifelong. Therefore, we need to address the issue very quickly and using evidence-based intervention, which, as I mentioned, focus on the combination of both treatment and then have dedicated service and train health professionals to address the almost 5 million smokers that we have in Malaysia right now. And another part that's worrying, as many people know, is the increasing prevalence of vaping. Mm-hmm. We have been having this epidemic of smoking conventional cigarettes, particularly for so long. in Malaysia. And only recently we have seen a slight reduction in the prevalence. It's always been more than 20%. But from the National Health Mortality Survey 2023, we have seen a reduction to 19%. However, the number is still large.
Yeah.
It's still 4.8 million smokers, almost 5. And the worrying trend that I mentioned about e-cigarette is particularly among our adolescents, our youth. They picked up e-cigarettes without being conventional smokers. Okay, so they are exposed to nicotine in electronic cigarettes very early as 6 or 7 years old.
Wow.
Yes, this is very scary. And I'm sure you have seen on social media, even toddlers, were given e-cigarettes by parents. That was really mind-blowing to me.
For some reason, my goodness.
Whatever reason, to me, that is tantamount to child abuse.
Exactly.
But anyway, going back to the issue of e-cigarettes, which we are seeing increasing very rapidly, especially among the adolescents, and the prevalence of vaping, we feel is going to also contribute to the increase in smoking, because some of them who started vaping then switched to conventional cigarettes, or they became dual users. They vape and they also smoke. So we are going to be dealing, and actually we are currently dealing with a dual epidemic of smoking and vaping. That's why the O in Mpower is very crucial.
Now, Mr. Munaver, what has the digital platform provide, especially in this context here over here? Because we see there are digital applications which actually help out these people. Now, I want to know from you, with the rise in technology, how effective are apps and helplines and online programs in helping people actually quit smoking? And are there any local initiatives using these kinds of tools?
Hi, good morning, Otto. Thank you
Morning.
for having me today here. I think this is my second time around in Traxx. Yes, to your question is that one of the initiatives of the Ministry of Health is the program which is called MQuit. So basically, MQuit stands for the Malaysia's flagship smoking cessation initiative, and involves the public and private partnership. Okay, with the aim to make smoking cessation services accessible throughout public and private sectors. So under this MQuit program, the Ministry of Health has launched MQuit portal. So this basically is an online smoking cessation service provider. Readers can Google, or the audience can Google to www.jomquit.com.my. Okay? So and JomQuit basically is enhanced with a quit line counselling system as well.
Oh.
So you can have for smokers or vapers who would like to know more about how to quit smoking, you can have free consultations, and the number is basically 1-800-88-8482. So I will repeat again, 1-800-88-8482. And the online portal basically promotes and facilitates registration of smokers for cessation programs, and it's currently managed by the National Cancer Society of Malaysia, NCSM. So as of date, we have almost 160 private healthcare providers and almost 760 plus government clinics and hospitals who are basically MQuit providers. So the results on this online portal has been quite promising, because their registered smokers has increased. Registration of registered smokers has increased from almost 7,800 in 2015 to 29,000 in 2023.
Oh, that's good.
Yes, but more importantly, registration must also be in line with the proportion of smokers quitting once you join the quit program.
Yes.
So this is something very, very promising, where the proportion of smokers who reported quitting has increased from 24% in 2012 to 50.1%
Oh, that's good.
2020.
Yeah.
Yeah.
So it goes
Really
that it shows that this initiative is actually working.
It's working.
And do you monitor after they quit whether they really quit, or probably they side smoke on the side, or probably second hand smoke or third hand smoke?
You see, the the issue with mankind, and the other one is the nicotine factor.
Yes.
You know, so the rate of quitting, there be up to 6 attempts of quitting.
Oh, 6 attempts.
Up to 6 attempts.
That means they quit and then they start
It
again.
may relapse.
Oh, relapse
You know,
again.
Relapse is very common.
Very common.
I see. Okay.
So to add on, Otto, in October 2024, the government has basically launched a chatbot which is called Cik Era.
Cik Era.
Cik Era.
Oh, okay.
She's quite good looking.
Oh, nice.
But she's an avatar.
Okay.
Okay. So the function of Cik Era basically complements the resources on the Jom Quit portal with the Quit the Quit line.
Okay.
Okay. So Cik Era basically will be the first initial contact that handles inquiries before routing complex cases to human counsellors.
I see. So she's the customer service before she actually, provides you the correct personnel or consultant, which is specific for that person.
Yes.
I see. Okay.
So I think this is moving forward, of course, with also the digitalization plan of the health ministry, working with AI and data analytics and involving predictive analysis as well.
Wow.
Yeah.
Oh, that's good. Okay, we're talking to Professor Dr. Muhammad Haniki Mohamad, head of the Quit Smoking Action Team, Medical Health Cluster Academy of Professor Malaysia, and also Mr. Munaver Ahmad, CEO, Rhazes TeleHealth International Sindh Berhad, MQuit Partner 4.0 MOH. And we're talking about strengthening the O in Mpower support to quit smoking and vaping. So once again, if you have any questions for today, for our good guests here today, head over to our TikTok or Facebook. Ask the question there, and definitely we'll post it up for you and ask the good people here. In the meantime, I just want to say a quick hello to Jade JMS. Thank you very much. Good morning to you. Najib Nawi. So once again, if you have any questions, let us know, or just give us a call at 0322825491 or 0322824746. We're going to take a short break, and when we come back, we're going to delve into this matter a little bit more in depth. So stick around. 30 minutes past 11. Good morning, Malaysia. It's Traxx Midday Buzz with me, Otto, live from Angkasa Puri, Kuala Lumpur. We're also live on our social media platforms, particularly on TikTok and also on Facebook. So should you have any questions on today's topic, which is about smoking, head over there right now and post your question. It's a heated question, of course, all kinds of stuff that you feel that you are dealing with. And I did post a question on my own personal account. Do you see actually a rise or decrease in people smoking in Malaysia? And most of you actually voted as in no. So it's quite surprising that seeing that if you just joined in, our guest here today, Mr. Munaver, talked about that the support that they have and also the implications of technology are actually improving those numbers to actually down the numbers of smokers so far. And it's surprising to see that more than 5 million Malaysians are actual smokers, but the people who are actually quitting are also like 50%, almost 50% quitting as well at the same time. So that's good over there. In the meantime, of course, we're talking to Professor Dr. Muhammad Haniki Mohamad, head of the Quit Smoking Action Team, Medical and Health Cluster, Academy of Professor Malaysia, and also Mr. Munaver Ahmad, CEO of Rhazes TeleHealth International Sdn Bhd, MQuit Partner 4.0 MOH. So talking about strengthening the O in Mpower, support to quit smoking and vaping. Now, we discussed about, of course, the current support system, also the policies about it. Now, we want to get into further details as well. So, Mr. Munaver, how can actual governments and organizations improve funding and also policies to strengthen cessation programs? And are they actually successful models from other regions that we can actually learn from?
Thank you again, Otto. So I think there are two parts of this question. So to elaborate more on the first part, Malaysia actually has developed a comprehensive plan to address tobacco control. We have the 2021 to 2030 National Strategic Plan for the control of tobacco and smoking products with three main strategies, three main objectives. Basically, the community empowerment, strengthening the law and enforcement on tobacco and smoking products, and of course, the Rakan MQuit program. Okay. However, at the moment, we do not have any proper funding mechanisms to support such cessation programs. Mm-hmm. So this is a gap. It's a large gap, and especially focusing on B40 population. So the National Health Mobility Survey 2023 reported that the smoking prevalence among B40 is almost 41%.
Wow.
Okay. So to go to the second part of the question, we should learn from our neighboring countries.
Yes.
Our closest country is Thailand, the neighboring country. Mm-hmm. They have this model which is called Thailand Syntax model. Okay. So this is an innovative approach where the financing smoking cessation programs is a three-pronged, strategy again. A nationwide anti-tobacco campaign, subsidized NRTs. What is NRT? It's basically nicotine replacement therapies. This is the so-called medicine, but it's is categorized as over-the-counter medicine currently. It has been moved from the poison counter to the over-the-counter counters, counters, for example. And this basically has been proven to reduce the quit smoking for smokers.
I see.
Okay. So, and also the funding mechanism involves training programs for healthcare providers. So it's a three-pronged strategy. And in UK, another country that we should look to is UK. They have the Stoptober program. Stoptober.
Okay.
Why? Because the program begins in October.
I see. Okay.
So again, a three-pronged strategy where you have a mass media campaign, and they have a quit smoking app, and also providing free NRT to those enrolling in this initiative.
NRT, what is that?
Nicotine replacement therapies. These are basically like
is it same as Thailand as well? The
yes,
NRT. I see.
So these are basically like you can have it in the patches. You have patches. You have the gum, chewing gums.
Yep.
And basically what Prof has mentioned, behavioral and pharmacological approach towards smoking cessation program. So when you say pharmacological, basically these are the medicine that were used.
I see.
To basically reduce the incidence of smoking.
I see.
So unfortunately, we do not have that funding mechanism in Malaysia, whereas there is according to WHO recommendation, there should the allocation should be 10% from the Syntax.
I see.
Syntax basically is the revenue collected from cigarettes and also vaping.
Oh, there you go. Prof, when it comes to that, at least it's one example of support. What about you, Professor? And in terms of support, what else have we done so far?
Okay. The crux of smoking cessation intervention, as mentioned just now, is to provide behavior and also medications. Actually, the hospitals, the government hospitals and clinics, they do provide the service, the smoking cessation clinics. There are more than 700 clinics that offer smoking cessation services through the government side. But we realize that there are also people who gain access to the healthcare through the private sector. So these are like community pharmacies, clinics, and also private hospitals.
Yep.
So what we have done is that we've launched a certified smoking cessation service provider program, which has been recognized by the Ministry of Health as a way to equip the healthcare providers in Malaysia especially with the knowledge and skills, additional knowledge and skills to help smokers quit successfully with the combination of pharmacological and behavior intervention. The medication mentioned just now can be in the form of nicotine gums, nicotine patch, and the latest we have the nicotine oral spray. So the two forms of NRT products, the gums and the patches, are over the counter. The mouth spray is group C poison, means that it can be obtained from pharmacies and clinics without prescription in the private, because it's a group C poison, but it needs to be dispensed by pharmacists and other licensed professionals. So healthcare professionals need to be taught about the nicotine addiction, understand how powerful it is in order to help smokers quit. Because once they understood that why people start smoking and why they stay as smokers, it can be multiple reasons, right? It can be because, as I've mentioned to you during the break just now, majority of my patients who come to the quit smoking clinic, they told me they smoke because they want to they use it as a way to handle stress. It can be work related, family, financial, anything. So what we tell them is that the medication, yes, they provide clean nicotine. Of course, the tobacco products and the e-cigarettes, they also provide nicotine, but they come with so many harmful chemicals and carcinogens. But the nicotine replacement therapy, they provide clean nicotine in order to reduce the craving and also the withdrawal symptoms associated with reduction or quitting. And we give this medication for about 3 months. In some cases, we can extend it for 6 months, but we don't normally give it beyond 1 year. Whereas what we are seeing in some countries, they're using e-cigarettes as a method to quit conventional smoking, right? Yes, to a certain extent, they can quit smoking, but they stay as vapors. Meaning that they still are dependent on nicotine. We don't want that. We want them to be free of nicotine in whatever form, but continue the behavior aspects. So we use one method called motivational interviewing, which means that we empower them to solve their own problems. It's like you're going to a restaurant and you ask the waiter, what's good here? So the waiter say, everything is good. But what's your preference? What do you like? What are you allergic to? What you don't like? You don't like spicy food, so a huge chunk of menus is taken out. Similarly, we need to understand our smokers because we treat them as individual. No two smokers are alike in my experience. They may smoke the same brand, the same number, everything, but they're totally different. So understanding the smokers and helping them individually seems to be helping. And all the tools that Mr. Munaver mentioned, the AI-based, the digital-based, the web-based, everything, strengthen this because they may not have access to us 24/7, right? But they have access to these facility systems and digital-based help 24/7.
So there you go. We are actually doing our very best, particularly when it comes to smokers who are chronic smokers as well. And one of our questions posted on TikTok, we have Najib Nawi says, what is the percentage of success in quitting smoking with these kinds of programs? I think Mr. Munawe already told us, he informed us that it's more than 50%. Those who registered in the portal and joined the programs, more than 50% have quit A relapse probably just a couple of percentage, but then again, the total number is more than 50%. So thank you very much for that question, Najib Nawi. He also asks, I quit during Ramadan 13 years ago. Well, that's good for you, Najib.
Congratulations.
Congratulations to you.
So yeah, if you want to add more, let us know how did you actually quit and what was your motivation, because some people might have the same situation but couldn't. So probably your experience could help our listeners as well. But anyway, we're going to take another short break. But when we come back, we'll delve even deeper on today's particular issue when it comes to smoking. So stick around right here on Traxx. 45 minutes past 11. Good morning, Malaysia. Health on Traxx. Yeah, definitely. It's a Monday, the 7th of April, and we have two very special guests in the studio. We're talking about smoking. Professor Dr. Muhammad Haniki Mohamad, head of the Quit Smoking Action Team, Medical and Health Cluster, Academy of Professor, Malaysia, and also Mr. Munaver Ahmad, CEO, Rhazes TeleHealth International Senior Berhad, MQuit Partner 4.0 MOH. Now, we already discussed the policies that have been in place and the actual also the percentage, which is actually a very impressive to me, and also how the support system in Malaysia is actually ongoing and helping out those to quit as well. So the numbers are there, the implications are also there, and we have neighbors also doing similar things just like Malaysia, which is actually a positive impact towards our community. Now, when it comes to, I was surprised to listen to our guest here off air that vaping is actually not a clinical proven method to actually quit smoking. Now, let's just expand on that. We'll start with Mr. Munaver.
Yes, I think to add on to your this topic, we do not have a clinical practice guideline for vaping as a tool or as, to stop smoking. That's one. Second thing, the vaping e-cigarettes are not registered in Malaysia under the National Pharmaceutical Regulatory Agency. So for a product to be claimed to be let's say to be claimed to be effective as a smoking cessation product, it must be registered.
And it's not clinically proven.
It's not clinically proven as well. But the thing that we tend to hear is that vaping is safe.
Yep.
Right. Which practically I'm going to tell you about the ingredients in vape, that you'll be surprised to know that you have formaldehyde in vape, which is used for embalming bodies.
Wow.
Okay. You have another product which is called acrolein. It is found in weed killer. Okay. You have benzene used in bug spray. You have diacetyl that is linked to popcorn lungs. What is popcorn lungs? Basically is a reversible lung disease, and vaping can also cause EVALI. EVALI is basically electronic and e-cigarettes and vaping associated lung injuries, and these are basically permanent scars in your lungs. So there are two groups of vapes that we know currently. One is with nicotine and one is without nicotine. So those with nicotine is added on with addiction for life.
Okay.
Okay. But without nicotine, you also have these diluents, solvents, and also all these synthetic products that will basically do harm to your lungs. The lungs are made to breathe clean air, but now we're breathing in all this
Toxic air.
Toxic air. Yeah, Prof?
Prof, what else? What else you have to add on that?
The harmfulness of e-cigarettes actually outweighs any potential benefits that it has for smoking cessation. That's why we have not seen any e-cigarettes being registered for this indication. And for any companies to claim that their products are useful for smoking cessation is actually wrong under the law, under the regulation. We've seen even health professionals claiming this, telling their smokers who are their patients to quit using e-cigarettes, and it's not right. That's why I mentioned just now we need to train our health professionals. And on this 14th of April, this Monday, there will be a masterclass on smoking and vaping cessation by a prominent professor, Professor Dr. Renee Bitun from Australia. She is going to stop by, and we're hosting her. We're having a workshop called this masterclass, and anybody who's interested in knowing what's the latest evidence on smoking and vaping cessation are most welcome to register to this event. So we call it a prelude to certified smoking cessation service trainers. We want to have trainers to be able to help others, particularly healthcare professionals, to help their patients, their smokers and vapers, to get this correct message. Don't quit by using e-cigarettes. We already have safe, effective and quality products under the Ministry of Health in the formulary, like the gums and the patches, or in the community. As I mentioned, we have the oral mouth spray. These are proven to be effective and safe. So why do you want to go to something that has not been indicated and approved by the Ministry of Health? I think it's a tactic by the industry, because by right, how can they produce products that have fruity flavors, that has so many chemicals, and actually designed in ways that would be attractive to children and adolescents who are non-smokers. And some of these companies are actually owned or subsidized or affiliated with tobacco industry in the first place. So they are trying to ensure that as many people are addicted to nicotine as possible. So our role as healthcare professionals and also the public is to ensure that people do not get trapped or targeted by the industry, both the tobacco industry in the form of cigarettes and also e-cigarettes.
Now, it is interesting to note that we have a lot of people in Malaysia who have quit smoking, tobacco addiction. And but the increase of people vaping is another new issue that is coming to the industry as well. So that's another issue over there. We just finished, helping out Malaysians quit smoking and tobacco addiction. Now we have a new era whereby new kids are actually thinking that, oh, this thing is cool, or maybe vaping is something that's new and we should try it out. But it totally boils down to you, the individual, and it's good that our initiative, the Ministry of Health, and also people just like yourself, Professor and Mr. Munaver, are helping out people to actually help out in terms of their stress levels, because most of them are basically because of either personal issues or financial issues. And you have counselors to actually deal with this as well.
Yes.
Because some of our... let's look at our TikTok account right now. So there are some people who actually suggest that, smoking is something which is a behavioral issue as well. Let's say Najib Nawi says how he quit smoke is because peer pressure from family members. His wife is pregnant and she cannot stand the sense of smoking, and also with the mother during Ramadan. So he decided to just quit altogether.
Yes.
So it's all about willpower eventually at the end of the day.
True. To a certain extent, you need that willpower. But the medication and the support from health professionals and also friends and family members should be ongoing.
Okay.
Because as I've said earlier on, we need to treat them as patients with a disorder or disease.
Now, with regards to the 14th of this month, is it? Is it called...
Masterclass.
A masterclass. It's only meant for health professionals.
Yes.
Health professionals. Okay. All right. So a quick hello to those who are actually online on TikTok. Tanga, thank you very much for that comment. We have also Shop Beauty, Najib Nawi, thank you. Dr. Melvin Dare. That's great, Najib. I would like to quit as well. The chance of relapsing is so high. Doctor Samo. We have also, who do we have? Abjona, thank you so much. Good morning. And everybody else for participating and also showing your love and likes and also sharing this whole conversation. But anyway, before we leave, I would just like to ask our guests here in the studio, before we leave, is there anything that you'd like to message to our listeners out there? I will start with the Professor.
Thank you. My message is simple. Don't start. But if you have started, and so get help to quit using health professionals who are trained, and make sure that you are tobacco free, and instill this in your children or your relatives and friends, because we don't need to be victims of the tobacco industry or the vaping industry, whose only agenda is profit.
Let's be a victim of success.
Yes.
Okay.
Be healthy.
Be healthy, exactly. Mr. Munaver.
It's okay. I will add on to what Prof has said. For those who would like to quit, you have the quit line again. The number is 1-800-88-8482. And for free counselling sessions, visit to the nearest KKM quit smoking clinics. Okay, you can find the range of quit smoking clinics on MySejahtera. Okay? And you can also ask the pharmacist about the nicotine replacement therapies, where they are selling the gums, the sprays, and also the patches. And relapse is normal. Okay, relax. So quitters basically try up to 6 times. And again, it is the motivation. In this the case of Encik Nawawi, the factor that made him stop was the wife. So the person closest to you are the most important.
The support system.
The support system is there. So we are here. The healthcare professionals are here. You have the community who are basically also helping out for those who want to quit smoking. And of course, awareness will be created among more awareness will be created in the media and also among the government agencies as well.
All right.
So
So thank you very much for those who are online and for those questions as well. We're going to go for a little short break. For now, we have BG's How Deep Is Your Love? Love Your Body. And that's it from Health on Traxx. Thank you very much.